I'd like to introduce Dr. Thangsing, our next speaker. He's a recipient of several awards, including the Royal Order of Samatre, which was awarded by the Royal Government of Cambodia for his dedicated and distinguished humanitarian work in HIV and public health. He graduated from Northeastern Regional Medical College in Manipur and was a postgraduate fellow of the Christian Academy of Medical Sciences in Vellore. His career started in 1990 when he provided clinical and psychological care, his HIV management career, sorry, I have to say as a life before that, when he provided clinical and psychological care for patients and advocated for the rights of people with HIV/AIDS. He established AIDS care programs in Manipur in 1993 and helped to set up the first AIDS care home in Delhi in 1998. He serves as an advisor and consultant for many non-profit organizations and for-profit organizations in Asia. He heads HIV programs for international organizations such as Project Concern International as its director. He collaborates with UN agencies, with pharmaceutical companies to build capacity and improve treatment skills of doctors, nurses, and other healthcare professionals to ensure delivery of high-quality care services through committed, compassionate care methods. But I think what he's most known for, and which I'm most proud of, and you'll see the association and why I say that, he's the founding president of the Touch of Hope Foundation, which he founded in 1993. His agency was supported by the South African High Commission for the 2012 International Mandela Day in New Delhi. The Nelson Mandela International Day, as you know, is the day that recognizes Mr. Mandela's contributions to democracy, racial justice, and reconciliation, as well as his service to humanity. Every year on July 18th since 2010, individuals around the world are encouraged to devote 67 minutes to helping others through various acts of kindness and generosity, such as volunteering in a hospital, doing chores for a neighbor, supporting a cause for good, tutoring a child, providing food for the homeless, or any other community service. And the Touch of Hope Foundation has demonstrated these kinds of services and was recognized by the Nelson Mandela Foundation for their work. Dr. Thangsing serves on several boards, professional, ethical, research boards, but he also is a keen photographer, and the U.S. Embassy showcased his work, Photos of Hope, at the American Center and Consulates in 2006, and released his music video, Song of Hope, at the U.S. Embassy American Center in New Delhi. He has established centers which deliver cutting-edge HIV clinical care and support services in 6 countries, namely Cambodia, China, India, Thailand, Vietnam, and Nepal, working in partnership and collaboration with governments and all sorts of global organizations. In conclusion, he's helped to establish over 30 AIDS care centers in Asia, providing life-saving medical services to over 30,000 people living with AIDS. Please join me in welcoming Dr. Thangsing to the podium.
Dr. Ain, Professor Snell, the Honorable Consul General of Peru, and my fellow excellent speakers, Dr. Rana, Dr. Vargas, and the team at Harvard, and my dear sisters and brothers. It's really a privilege to be here at the 3rd Stigma Conference in the United States. And I bring you greetings from 1.2 billion people. That's India. And namaste. It's kind of strange because for the last 7 to 8 years, I work for an American organization, and whenever I travel, I said, I bring you greetings from the people of America. But today, I bring you greetings from India. And even though I'm the last to speak, I'm going to extract my pound of flesh. Don't expect that because I'm the last, you're going to leave early. I also know about the story, and I believe you know, there was one last speaker, And he spoke as long as he wished to speak. And then at the end, there was only one person. And he was so very grateful to that guy who still was there. And he said, "Thank you very much, my brother. What can I do for you?" He said, "No, you just get lost. I'm just the janitor. I'm just waiting to clean up." Yeah, but today, I know that if all of you leave also, protocol won't allow my fellow on the dais to leave. And at least I know Dr. Rana and Dr. Vargas is going to be there with me. Well, here's a picture. It's not very clear, but there's me with a parrot in my other finger, and then there's a little child there who is HIV positive. Before the pediatricians in India start treating AIDS patients, I started treating AIDS children. And I came and learned how to treat AIDS children in Oakland Hospital near San Francisco. Well, about 2 months ago, I was reading the paper one early morning, and then there was a story about a woman who was from the village. There was no medical service in the village, so she has to travel 200 kilometers away to the hospital in the city. She traveled on foot, she traveled in a bullock cart, somehow managed to reach the hospital. And when she reached the hospital, no one would take care of her. She was not even admitted. She was lying in the corridor. The baby came. The doctors were not there. Nobody was there. And then the cleaning lady, the sweeper, was so deeply touched and sad that she cut the umbilical cord. And that's 30 years after we discovered HIV. I was totally angered, sad, but at the very same time, I was invited to speak here, and I said, yes, the fight has to go on. My fight about HIV started off in 1990 in India. I was working in a mission hospital. I was a chief medical officer till suddenly one day the government gave me a list of 300 people with HIV, and I looked at that list, and then there I saw the name of my friends. I saw my distant cousins. I saw those friends in high school. And then that time we do not know about HIV also. And then what happened? I looked at the list of people who are dying, and I began to mourn for those people. So then one day, then I realized that there is total lack of understanding, there is lack of knowledge about HIV, and then there were myths and stories circulating saying that if you look at an AIDS patient, you'll get AIDS or HIV. And if somebody with AIDS look at you, you'll get HIV. So therefore, the people in the community were afraid. And at that very time, I have a patient in the hospital who need a surgery where we got to remove the stone from his ureters. My nurses were afraid. They said, let us send him to the big hospital in the bigger city. I said, no, this is not a big surgery, and we're going to do that. We have tackled hepatitis B, so we're going to tackle this one. And I took the lead. That is as early as 1993. So that was how I came to learn about stigma. The more I learn about stigma and the more I see discrimination, the more I wish to work for the community or to work for people who are HIV positive. And when I took that decision to really take care of these AIDS patients in my community, I was afraid because my colleagues start stigmatizing. There's a doctor, he's treating AIDS, and then I was afraid that my practice might suffer. Why? Because I'm treating AIDS, other patients might not come. But that was just a fleeting thought. And I said, no, I'm going to do it. And I start caring for these people. When the community see I care for these people, automatically they become unafraid. Not only does my practice strive, or, I got more patients. People are not afraid to come. People who are not HIV positive were unafraid to come. So instead of having a few, I start seeing 90 to 100 patients in my own private clinic. That's where I began working there. But then I began to help the local community, and we have the Society for HIV Lifeline Operation in Manipur. And one day, there was a young man about 19 years old. And then he was there, and he was referred from the bigger hospital. We don't have a big hospital. We have a small clinic. We don't even have a surgery room there. But this patient was waiting for me. And then when I went there, he had a big lump on his thighs, and I was seeing whether there's still rubber, dollar color. I was seeing whether I can operate, I can do an incision and drainage. And I touched him, and I was examining him, I touched him. Then his tears came. He started crying. He was a tall 6-foot guy, and he started crying. And then I said, did I do something wrong? Did I hurt you when I was touching you? He just shook his head, but I insisted. I'm very insistent and sometimes very persistent. So then he said, no. And he said, you touch me. That was the time when I coined the word, the touch of hope. So today, the simple act of touching, the simple act of being there is enough to fight stigma. And then that was 1993, 1997, I moved to New Delhi, the capital of India. And it was a good move because when I was there, none of the doctors in one of the biggest cities in India, which has got more than 13 million people, 14 million people, do not have a doctor who would touch HIV patients. One of the young boy, a 24-year-old boy, was thrown out from hospital because he had HIV. He was thrown out from 9 hospitals, including All India Institute of Medical Sciences. That's the most reputed hospital in the country. Somehow, with help of activists, or there were really no activists yet, with help from celebrities, with help from somebody from WHO and from the Ministry of Health, we helped him get into the hospital. But he was kept in the extreme corner, and there was puddle of water and dingy little things, and doctors would not even go there. But I was just a visitor there in Delhi. I was traveling. And then when I went, he held onto my hands and said, don't leave me here, sir. I said, I can't. You have to be here. This is hospital. There are doctors and nurses. And I don't have a hospital here in Delhi. What am I going to do? What am I going to do? He said, no. You take me from here. I would rather die than face the look at these doctors, than face the look at these nurses, or how I'm treated. Don't you see? Look at me. I know I'm going to die. Let me die in your home, even without medication. That was the power of stigma. That was discrimination. Then all the more, I grew interested in fighting the stigma. And that was the beginning when Richard Gere came to India. And with the celebrities in India, the movie stars, they invited me, so we started a campaign in India that's as early as 1998. And then one campaign went to another campaign to another, so people all around the country comes to me, and then also a lot of papers were written. I was asked to write question and answers in the papers. I was asked to write for magazines. So ultimately, later on, I ended up having a column in Marie Claire, India edition, for a year. So I'm a single person, single, an individual, but however, with help of many people, advocates, with the UN system, with the government of India, we definitely did a lot of change in India. So one of the first thing I did, I was new to New Delhi. I was from a small hill station working in a small missionary hospital. I came to Delhi and I started facing this one. And the first thing we did was that we filed a public interest litigation in a fight against stigma against HIV positive people in the Honorable Supreme Court of India, where we don't want to find fault with hospitals. We don't want to find fault with the doctors. We don't want to find fault with the government. We said, we want a remedy. Then I told the government of India, saying that you give me a hospital, I will demonstrate how you've got to treat HIV patients without stigma, without discrimination, with care, concern, and love. Then the government of India, the health minister, called us, especially after the boy who was thrown out from 9 hospitals died without treatment. Then they invited me and a few, 3-4 people. That's how we recommended to the government of India to start an AIDS treatment homes. If you don't have homes, these people are thrown out, neglected, discriminated. Where will they go? Before the government, you structure yourself to fight, to prevent, and care for. Before that, people are already dying. Give us a space. That is when the government of India, for 1.2 billion, at that point of time, 5 million HIV positive people in India were supposed to be HIV positive, were there. And the government of India said they will support 6 centers which can accommodate about 16 patients. 6 into 16. That's what the government gave us. So with that, I started the first AIDS care home in Delhi, which has become a center of fight against AIDS and stigma, because I have wonderful people, movie stars from the country, movie stars from the United States, the HIV policy person of the President of the United States, Kofi Annan's wife came and visit me, Bill and Melinda Gates came and sat with me and talked to my patient for 2 hours. So it has become a center of fighting for stigma and discrimination, which Howard is doing now. It's so wonderful. Then, having said that, there's so many things we did, but I'll just really move a little bit faster now, and then we move. Then one of the most important thing I did was talk to the doctors, 15 doctors here, 20 doctors here, all across the country. That's what we have been doing. Then I have Photos of Hope, as it was introduced. The US Embassy has circulated the Photos of Hope of HIV positive patient, my patient, who survive, who fight, and who dare come out unafraid of being stigmatized or discriminated. We have that one, and then we wrote about the Song of Hope, which we have released in Los Angeles when I was working for another American organization where I look after 6 countries. Then in terms of the fight against stigma and HIV discrimination, is people need to be more aware and more aware. So therefore, we launched a campaign like an AIDS signature campaign. So once we launched the signature campaign, it is so difficult to meet the Prime Minister of India. People waited for a year, people wait for 6 months. I launched a signature campaign where, of course, we launched for 10,000 signatures, and we just dumped it in the Prime Minister's office, and it took us 15 days to get a meeting with the Prime Minister of India, where we told them stigma is there, we need universal access, we need second line of treatment, there is corruption in the AIDS control organization, we want the AIDS bill to be passed in the parliament. So such are the things we have done. And then also we have Love Condom campaign, and then we also started, since last year, we started something called Football for Hope. In this Football for Hope, all the activities we do talks about HIV, and it has HIV positive people in the programs. So this Football for Hope, we invited 16 embassies, the staff of the 16 embassies, to play football. They play soccer. And we have an HIV positive team, so that the embassy people also play with them, and we said, here is an HIV positive team. They came third in this thing. Actually, such are the kind of things. Then we started another thing called Keep Hope Alive. To keep hope alive, we have regular meetings of people HIV positive talking about their life and the sufferings and all those things we did. And then now we have Thinking Positive for Hope coming up, Arts for Hope coming up, and recently one group of the freak wrestling people, it's like the WWF wrestlers, they come and approach us that we want to tie up with you as like Football for Hope, and what should we call it? Let us call it the Fight for Hope. So Fight for Hope is waiting there, and then we are asking for the Oil and Natural Gas Commission to support us. So we expect at least $500,000 US from them, and hopefully we get. Even if we don't get it, we're going to do it anyway. So then we started off like a consortium of AIDS treatment access people, association of aged care physicians, and a lot of things like that. And another thing which we started off, and I wish that we will collaborate with whether it is CDC or whether it's WHO or whichever group here in the United States, and also, of course, Harvard, is that we started off this one, but we couldn't. It is a kind of taking a pledge to conquer HIV stigma. It's very simple. We need 30 people ready to talk to 30 people for 30 minutes within 30 days. Okay? So we got more than 30. I think we can all be volunteers. Many of us have Facebook friends, 5,000 Facebook friends, 2,000, 100, 200. At least somebody here have at least 40 people we come into contact at work or at the cafeteria, don't we? Or do we have somebody who has less than 30 people in touch? No. So therefore, we need 30 people to talk to 30 people for 30 minutes, at least within 1 month. Within 1 month, you should reach out to 30 people. So 30 to 30, 900. 900 into 30 is 27,000. 27,000 in 30 is 8 million, huh? Yeah, then you multiply. So the 30 people has to talk to 30 people and ask them to really commit themselves to get the pledge from that guy or that woman. Say that at least my brother, at least my sister, talk to 30 people. Will you? You had the commitment. You talk to them in the cafeteria, you talk to them in the movie hall, you talk to them in the flight, you talk to them when you're sunbathing, you talk to them when you're in the loo. It's okay. But at least we will bring some information to these people. Well, to move ahead, to move fast, here's me, finally, when 10,000 signatures went to the Prime Minister in 15 days. What do you want of me? The Home Ministry, the security people call us, we went, and he gave us 15 minutes anyway. So in my travel within the country, within those countries, one of them is China. This is one of the education, we got so much education program for doctors, healthcare workers, and nurses. And this is one of my favorite one. This way back in 1999, when the newspapers, I was running around the country, and then they said, I'm catching a flight. Then they said, there's one more message. What will you do for an AIDS patient? Because at the time ART was not available. ART came in like 2004. So then I said, at least a hug in time. Give a hug. Not to the family, not to your lover, but to an HIV positive patient. So that's why they just call it a hug in time. So I propose a hug in time to defeat stigma. We've been doing that 20 years, personally, 20 years for me, 25 years of medical practice. I still like to hug. And I think this is really important. Then these are the singers, these are professional singers in India, where they sang the song I wrote, for the US Embassy in India. And then this is very recent, this is just 2 days ago. In Delhi, we have a Rex conference in the lines of TED. And then this year, I have started something called the Hope Alive Award. To people who will be given, who has actually given hope to somebody dying, especially for HIV. When I was working for the CDC GAP in India through Project Concern International, You should have seen the slums in Delhi, in Pune, in Maharashtra, in Mumbai, in Chennai. The people, my patients, they don't even have 2 square meals. You go and visit a patient in the home, you can see the furnace area clean. There were no ashes in the oven. Why? They don't have a thing to cook in the morning. They're dying, there's no HIV medicine, there's only TB medicine and maybe Bactrim and maybe a few antifungal medicines. The patients are so sick that when they take the medicine, they'll vomit. The wife goes to the market and spend the whole day sharing some vegetables and come back home with less than $1, 75 cents a day. That's 90% of my patients then. But I have patients who are models, who are movie stars. I have them. They can spare $1,000 a month, but I have people who have got 75 cents a day. So when we go there and be there for them, you can see the smile in the face of the patients that is keeping hope alive. So we start awarding the Hope Alive Awards from this year. That's to encourage people to work more in the fight against HIV. This is some of the pictures for Hope. This is me signing, behind the United States flag, representing America in those 6-7 countries. This is a little bit of Football for Hope, our logo. We've been playing football, thinking positive for hope. This is a format to attract young people. Today, young people can make videos from the camera, your iPhone and smartphones. We want them to send in 3 minutes, maybe 2 minutes to 3 minutes clips. We have a category of PSAs, a little bit of documentaries, and innovative ideas and cartoons and things like that. So this will bring it together, and at year end we'll have a panel. So this is the idea, to go to the people using social media, so that people would think. If you speak to them, tell them, do this, do that. It doesn't spread like this. They don't. But when you give them a competition, they read about it, they talk about it, they're excited about it, they do something about it. That way, we bring up their information, and then we also, engage them. Now here, in terms of stigma, it is not us or not them, it is we. So we must take up a proactive role, all of us, and care and concern and compassion and love. That gap between human beings must be removed, and the healthcare fraternity, community, and we must become hope givers. If you care for someone, you'll be concerned. Hey, don't go there. Don't do that. Hey, don't touch that fire. You're concerned. And when you're concerned and you love somebody, you have the compassion. Though there are a lot of tools for stigma index, tools to control HIV. One rapid test in the morning we have. We have post-exposure prophylaxis, pre-exposure prophylaxis. We got antibiotics, we got antiretroviral, but there's no medicine for stigma, no injection. So therefore, I'm saying that we need care, concern, and compassion. And the next move, of course, I've got a lot. I think the next move is many of you want to move out the door, but then whatever it is, I would like to say that let us begin now. It seems to be kind of stale, isn't it? It seems to be very sad after 30 years of HIV. Of course, there's still that one wave have gone, one wave of healthcare providers have come who are more sensitized, that they have moved on. New people have come. That is going to go on and on and on. Therefore, today let us begin. And yesterday is gone, tomorrow is yet to come. We have today with us. Let us begin. Let's go give a hug, and that's the only way to begin breaking the walls of stigma. And nextly, what I wanted to say, the next move for the stigma center here is that to have other centers in Asia, in Peru, or Latin America, in Africa. So we'll have all that when we have like-minded people, like all of us who are here, all of us who are here today, braving, or braving the desire to get out Friday night, but you're still here. We need such kind of people. We need such kind of people. So therefore, let love, care, compassion, and concern be one thing we'll take back from here. Thank you very much.